clinically relevant language through the maze of mental health medications, then help you identify ways to use your expanded knowledge to improve client outcomes. Throughout the text, the terms patient and client will be used interchangeably per the context of the discussion, but essentially mean the same thing. New to the 4th edition. The importance of developing client rapport. A more detailed look at depression and its origins. Antidepressant strategies for the first-timer. Behavioral activation therapy. The importance of getting clients moving. Suicide and its rising prevalence. The emergence of ketamine for depression. Antidepressant discontinuation. Mindfulness. Spravato, the first really new and original antidepressant in more than 30 years. Key questions to ask when assessing for bipolar disorder. Lithium, still the best after all these years. Anxiety treatment, what should not be medicated. Benzodiazepines, still viable after 60 years. Much expanded section on insomnia. Opiates, opioids, and the crisis surrounding them. Chronic pain management. Update on the etiology of schizophrenia. Adult ADHD and assessing it correctly. New medications for ADHD. Updates on herbal and other alternative treatments. Talking to clients about psychotropic medication side effects. Telehealth treatment. Psychopharmacology, Straight Talk on Mental Health Medications, 4th edition, is a desk reference suitable for healthcare professionals and for anyone interested in expanding their knowledge of how to best manage mental health disorders, both pharmacologically and behaviorally. Joe Wegmann, New Orleans, Louisiana. Section 1. Getting Started with the Client. Chapter 1. The DSM, Medical Model, Neurobiology. Biological psychiatry focuses on understanding mental disorders from an organic standpoint. Specifically, it focuses on the functions of the human nervous system. The practice of biological psychiatry dates to ancient times, yet the term itself was not used until the mid-20th century. That's when research, creation, and the use of newly developed drugs intensified, resulting in new classes of pharmacological agents, including sedatives, antidepressants, and antipsychotics, which addressed mental health disorders. The DSM. Around the same time these new drugs were emerging, there became a clear need for a dependable body of knowledge that would assist clinicians in defining the approximately 100 diagnostic mental health categories used at the time. In 1952, the first Diagnostic and Statistical Manual of Mental Health Disorders was published. Better known by its initials, DSM, the guide is now in its 5th edition, DSM-5. With the arrival of the DSM, the emphasis shifted to more descriptive and biological models and treatments, and away from the psychoanalytically based models and treatments of Freud, Adler, and Jung. Theorists and clinicians who were more interested in the why of a disorder than its what. Also, where the older psychoanalytic models tended to classify individuals, the DSM classifies disorders. We used the DSM to compare the signs and symptoms of our client presentations through a set of objective criteria. The DSM serves as a guide to clinical practice by helping clinicians define disorders more consistently. This, in turn, allows for a better prediction of prognosis and treatment response. The DSM-5 was in development for more than 10 years. Its official release was announced in May 2013 at the American Psychiatric Association's annual meeting in San Francisco, California. New diagnoses have been added and others have been amended or combined. Some proposed criteria considered for inclusion stirred up so much public and professional ire they were eventually eliminated from the final draft. The most noteworthy changes to the manual are concept-driven. The multi-axial system of the previous DSMs has been dropped in favor of a dimensional diagnostic scheme. This new format combines...
To keep listening to this audiobook, I've left you a link in the description so you can do it, at no cost thanks to Audible's 30-day free trial.